My name is Jiwon Min. I'm a clinical assistant professor at Bucheon St. Mary's Hospital, Catholic University of Korea. I'm a nephrology specialist. I'd like to share with you preparing processes of a kidney transplant operation from a nephrology perspective. So kidney transplantation is an excellent renal replacement treatment for patients with end-stage kidney diseases. It is permanent. The end-stage kidney disease is a permanent condition of kidney failure that often needs dialysis. A kidney transplant is a surgery that is done to replace the diseased kidney with a healthier kidney from a healthy donor, relative donor, or from a diseased organ donor from a diseased organ donor. Family members or others who have a good match may be able to donate one of their kidneys. So this type of transplant is called a living donor transplant. To get a kidney transplant from an organ donor who has died, a cadaver donor, we also say, you must be placed on a waiting list of the organ sharing organization in your country. So in Korea we call it the KONOS. So extensive testing is usually done before you can be placed on a waiting list for a transplant, or if you are waiting, or if you are preparing for a transplant with a relative donor. Diagnostic tests may be done to check your kidneys as well as your overall health status, especially for the presence of malignancies or infections that may cause a problem after the kidney transplant operation or during the transplant operation. So usually we perform blood tests, x-rays, ultrasounds, CT scans, dental exams, gastric endoscopies. For women, we may get a pap test, a gynecologic evaluation, and a mammogram. For men, we might need a prostate evaluation as well. Also to observe whether there is preformed antibodies that may attack the graft. After the transplantation, we perform a few blood tests to observe how the titer of the different antibodies. If there are the different antibodies, we may have to perform pre-operation plasmapheresis or medications to get rid of the antibodies or to alleviate the antibodies. So to prevent these antibodies from forming, I usually teach my patients to refrain from getting blood transplants if they are preparing for a kidney transplant. So if you have any more questions on dialysis, kidney transplantation, or kidney diseases, please contact our hospital international unit. We will be happy to answer your questions.